Assalamu alaikum wa rahmatullahi wa barakatuh. We will continue our talk about the anatomy that's pertinent to urology. In the last part, we have talked about the kidneys. Now we will start talking about ureters. As we have said, the urinary tract is divided into upper urinary tract, kidneys, and ureters, and lower urinary tract, which are bladder and urethra. We have talked about the kidneys. Now the ureters. The ureters are two muscular tubes whose peristaltic movement or contractions convey urine from the kidneys to the urinary bladder. So it's a tubes that's it is just function as transporter, urine transporter. In adults, the ureters each ureter is 25 centimeter to 30 centimeter in length, with a diameter which lies between 1.5 to 6 millimeter. Generally, we can say it's 3 millimeter in diameter, and this diameter is less in three places. Now, the location is usually just lateral to the tips of the transverse processes of the lumbar vertebra in the abdomen. As depicted in here. And that we can divide the ureter anatomically into three parts or surgically. The urologist can divide them surgically. The anatomical classification is classified into abdominal segment, which is the segment lying inside the abdominal cavity, and it is starting from the PUJ, the pelvic-ureteric junction, reaching into the iliac crest inside the abdomen. And the pelvic segment. The pelvic segment is the segment inside the false pelvis and the lesser pelvis, which is the true pelvis. And we have the third segment, which is the intramural segment. But in clinical practice, the urologists divide the ureter surgically into either upper ureter and lower only, or upper, middle, and lower ureter. If we choose to divide the ureter into just upper and lower, in next slide. Now, this surgical classification is dependent on the vascular supply, as we can see in the upper ureter, which is extending from the PUJ, reaching the crossing of the major vessels in the pelvis, the common iliac, or sometimes the external iliac artery and veins. The blood supply is coming medial to lateral from the side of the aorta and the renal artery, also the gonadal vessels. While in the pelvis, the lower segment, the blood supply starts to come from the lateral side, from the common iliacs, external iliac and internal iliac arteries. That's why the upper segment is from the kidney to the crossing of the vessels, and the lower segment from the crossing of the vessels reaching the urinary bladder. While a more common classification is to classify the ureter into upper, middle, and lower, depending on bony prominences. So the upper segment is continuous from the PUJ, reaching the upper border of the sacroiliac joint, especially on KOB. This is very easy to identify. Then the middle ureter is from the upper border of the sacroiliac joint, reaching the lower border of the sacroiliac joint. This is the middle ureter. The lower ureter from the lower border of the sacroiliac joint until reaching the bladder, including the intramural part. This classification will help us to classify such conditions like stones, because ureteroscopy is easier before reaching the crossing of the vessels. So in the classification of upper ureter and lower ureter only, ureteroscopy in the lower ureter is easier. After crossing the vessels, we will have an angle inside the ureteroscopy, and it will become a little bit more difficult. In the management of stones, also the lower ureter have higher rates of passing smaller fragments of stones, while the upper ureter is different in selecting the first choice in the management of stones. Finally, I would like to thank you again for listening to this video. See you in the next video.